So there's a lot of reasons why cochlear implants are so underutilized in this country. I think from a lot of our research, we've shown that poor awareness in both patients and providers has been a big factor of this. A lot of people simply don't know what a cochlear implant even is, or, for example, how it's different from a hearing aid. There's also still a significant amount of stigma when it comes to hearing loss in general. A lot of patients don't want to wear a hearing aid, for example, because it looks a certain way or it conveys a certain image. Issues with lack of surgeon availability or lack of professional connections between audiologists and people that take care of hearing loss, as well as surgeons to do cochlear implants, is an issue. Socioeconomic issues play a big role as well. So this is a pretty multifactorial problem that's still ongoing. As far as geographical variation in terms of cochlear implant access, we know that typically most large cochlear implant programs are in major cities. In rural areas where there's less access, patients have to drive a considerable amount of distance to get their cochlear implant care. So one of the major questions that we were interested in asking in our study was the question of, does diagnosing more hearing loss, aka audiology use, result in more cochlear implant utilization? Because one would think that the more hearing loss you diagnose, the more people are aware of cochlear implants and the more that they get. And we found that to not actually be true. And so we found a lot of areas in the United States where there was really, really high use of diagnostics and diagnosing hearing loss and prescription of hearing aids, but very, very low referral rates for cochlear implant utilization. And so that suggests that there's probably a significant amount of under-referral at play, that even though someone gets their hearing care and gets a hearing aid, they're still either not told a cochlear implant is an option, or that they just simply don't have access to a cochlear implant center that they can call. So one of the major findings in this study shows that there are many areas in this country that still have really high rates of audiology use, meaning the diagnosis of hearing loss and the fitting of hearing aids, but still relatively low use of cochlear implants. And the perfect example of that is actually the Chicagoland region, where we have actually relatively high use of diagnosing hearing loss, fitting of hearing aids, but then a relatively very low rate of cochlear implant use. And when you see something like that, that just suggests that while there are tens of thousands of candidates for cochlear implants in this area, that they're simply not being referred, or there's not enough surgeons available to do the procedure, which obviously impacts access. I think the implications from this study show that continued lack of awareness in both patients and providers of what a cochlear implant is or how it can help a patient is still one of the major issues at play, because we are seeing high uses of diagnosing hearing loss across the country, but relatively low use of cochlear implant utilization. And so we think that under-referral and lack of awareness are things that we can potentially act upon and improve to increase patient awareness and patient access to cochlear implants. Here at Northwestern Medicine, we're really trying to improve patient access to cochlear implants. And we're really starting to do that by building relations with people in the community that provide hearing care. So referring audiologists, referring otolaryngologists, teaching them about when to refer and how this can be such a great benefit to their patients. And we're building these networks and performing outreach to promote awareness and increase patient access. We have a huge multidisciplinary team of surgeons and audiologists and researchers and speech pathologists, all dedicated to that personalized level of patient care. We also have a lot of research efforts going on, from the understanding of basic sciences to how hearing loss works, to improving rehab efforts, to how patients after their cochlear implant can do better rehabilitation to get the best outcome from their device. And we're very, very interested in using the latest techniques and advances. We're using robotic surgical techniques. We're using the latest imaging techniques to map out their cochlear electrode to that specific cochlea. There's a lot of really exciting stuff going on in Northwestern Medicine. I think we really have the comprehensive team to take care of these kind of patients.